Hello, and thank you for joining us today. I'm honoured to introduce the LiveSave report, saving over 2 million lives in Japan, a groundbreaking analysis supported by leading international and Japanese experts in tobacco harm reduction. This report highlights the urgent need to address tobacco-related mortality through innovative harm reduction strategies, improved cessation support, and advances in lung cancer treatment. Japan is a compelling focus for this study, and for good reason. Despite having one of the most advanced healthcare systems in the world, tobacco use remains a significant public health challenge. Over 157,000 people in Japan die prematurely every year due to smoking-related diseases, and current tobacco control efforts alone are insufficient to meet WHO projections of reduced smoking prevalence. However, the rapid decline in cigarette sales, halved between 2011 and 2023, thanks to the adoption of heated tobacco products, underscores Japan's potential to lead global change. The findings of this report are transformative, and by complementing traditional tobacco control with harm reduction, Japan could save over 2.04 million lives by 2060. This is a major public health opportunity, demonstrating how science-based innovations can be integrated into policy to achieve dramatic health gains. This report is not just about statistics. It's a call to action for governments, healthcare professionals, and consumers to align on evidence-based solutions. The focus on Japan serves as a model for what is possible worldwide when we prioritise harm reduction and public health together. I look forward to sharing more insights from this report as we explore how these findings can drive meaningful change in Japan and beyond. Now, let's look at the agenda for today's session. So firstly, I'm going to briefly explain why the focus has been on Japan for this report. And then we have a keynote speech by the principal author, Dr. Derek Yach of the US, who will provide an overview of the report. He'll talk about the study rationale and significance, the methodology, results, and recommendations. We'll then hear from Dr. Hiroya Kumamaru of Japan, who is a heart surgeon, and he'll discuss how harm reduction methods have contributed to more than 50% decline in cigarette sales in Japan between 2011 and 2023. And then I'll discuss the role and importance of science advocacy in tobacco harm reduction in Japan. So I'll briefly go over the biographies of the speakers. So we have Dr. Derek Yach, who's a former WHO and PepsiCo executive. He's a physician and has a master's in public health from Johns Hopkins. He played a key role in the WHO Framework Convention on Tobacco Control and led global health at Yale and the Rockefeller Foundation. He now consults on global health, focusing on smoking cessation, mental health, and healthy diets. Then we have Dr. Hiroya Kumamaru of Japan, who is a cardiovascular surgeon and vice director of a hospital in Japan. He's been working on preventative medicine for more than 10 years, and tobacco harm reduction is one of the areas of his interests. And then myself, I have a background in science. I'm a chemist, and I've worked for most of my career as a product developer in a multinational company. I now focus on advocating for harm reduction, and I lead several advocacy platforms, and I'm a co-founder of tobaccoharmreduction.net. So now we will hear from our keynote speaker and principal author, Dr. Derek Yach, who will provide an overview of the report.
Thanks, Jessica. And it's really wonderful to be able to talk about a country where we're seeing extraordinary progress in reducing the impact of smoking, driven very strongly by the benefits of tobacco harm reduction. So before commenting on that, maybe a few words about the basics in terms of numbers of smokers and so on. In Japan today, there's still about 29-30% of men smoke and 10% of women smoke. The consequences of much higher smoking rates in the past and continued smoking today mean that about 160,000 people die every year of tobacco-related deaths and disease. And those would be predominantly lung cancer, COPD, cardiovascular disease. Um, as I mentioned, though, the good news is that over the last decade or so, we've seen a decline by almost 50% plus in the per capita smoking rate, driven heavily by heated not tobacco product use soaring in the country, making Japan now one of the world leaders in actually driving forward progress in smoking with harm reduction. The purpose of this report, though, is to see whether and how Japan can go even further and to look at what would be the benefit if they were to apply a fuller range of tobacco harm reduction products, add to it better cessation, and also apply what have been major advances in lung cancer diagnosis and treatment across their population, given that that is one of the major causes of tobacco-related death. We do this by carrying out a series of modeling exercises that are well described in the report and build on the expertise of others, both in the public and private sector over the last few years, and make very conservative assumptions, really, about the rate of increase and the rate of access to tobacco harm reduction or better forms of treatment. What we really showed was that if the Japanese government and people were to have better access to tobacco harm reduction over the next few years, we would see the current number of deaths that are projected to happen by 2060 by WHO of 104,000 a year to drop to 64,000 by applying tobacco harm reduction a year. In addition, if the full effect of better cessation and harm reduction and diagnosis and treatment of lung cancer were applied, we would see that number drop to about 43,000 a year. Still a big figure, but dramatically lower than the 100,000 that WHO is predicting under a status quo approach. If you sum the number of deaths that translates into over the next few decades, you come up with a figure of 2 million plus deaths to be saved, lives to be saved, if we are to have greater access to tobacco harm reduction. There are very few countries in the world where that number would be as high. And it's really based on two things. The one is the relatively high smoking rates still in Japan, and obviously the size of the Japanese population, and the fact that Japan is one of the leading industrial countries where innovations in technology, be they the preventive side or the treatment and diagnostic side, really have a chance to improve the quality of life of the people of Japan. So, if that's the case, almost 2 million lives to be saved, the question then is, what is it that we need to see happening? And just to mention two important groups. The role of physicians has always been really dominant in Japan in driving all aspects of health policy. Japan is home to a very strong national health service, which means that the vast majority of people don't have serious financial barriers to getting access. There is good screening, there's good diagnostics, there's good treatment. The problem is that much of what we hope for in tobacco control is still not fully executed in the primary care clinics. Our first recommendation is that physicians play a much stronger role on the secondary prevention of related to smoking, knowing that they see their patients with COPD, patients who smoke, people who've got cardiovascular disease, early stage lung cancer, almost every year at an annual screen. That's unlike most countries. And that regular relationship with the physician gives them the chance to advise and recommend that they don't just try tobacco harm reduction, that they try tobacco harm reduction products, not just heated tobacco, but eventually include in the portfolio nicotine pouches, vapes, and other related products. We know that the more choice people get, the more likely they are to actually take up one of these products or use them in combination. So the role of physicians is vital. We also think that it's about time that the physicians and the leading medical groups in Japan worked with the Royal College of Physicians in the UK to put out a scholarly report documenting the incredible progress that they have made and actually asking these questions about how and can we go faster by introducing a wider range of products. On the government side, really two big recommendations. The role of government policy generally should be to make the healthier choice the easier choice. And in the Japanese environment, the two most important things from our point of view are to address the need to have a large tax differential. That means that the price of harm reduction products will be substantially less than the price of combustible cigarettes. Making sure that that price differential is meaningful will actually have a long-term benefit to the people of Japan and reduce, in fact, the economic burden of tobacco. The second differential we need is in the way we talk about the hazards and risks of these products. So we need to have a differentiated message that doesn't actually spell out the harms and dangers of nicotine to the adult smoker, which are really incredibly minimal, but rather stresses the damage is caused predominantly by combustible cigarettes. That's where the harm comes from. It's the smoke in the cigarettes that's killing. It's not the nicotine. And if we were to have those two differentiated approaches in policy, differentiation on price and differentiation on messages, supported by the physicians, we know that the declines we're seeing now could accelerate even further.
Yeah, and we talked about the tax differentials, and it's a real shame that in Japan, when HTPs were first introduced, the tax rate was quite a bit lower than cigarettes. I think it was 10 to 70%. They ranged from 10 to 70% was the tax rate. But they've actually got parity now with cigarettes, haven't they, Derek, in Japan? They've raised the tax rates gradually over the years on heated tobacco products.
Yes, and I think that that is extremely unfortunate because the
Yeah.
hard data we've seen has shown the enormous benefits that we're seeing in terms of people switching, which we know is going to translate into better health outcomes. We also know that there will be some companies where maybe they are continuing to be ambivalent about getting out of their tobacco business and really keeping harm reduction as a sideline. Some of the leading companies, particularly BAT and PMI, have had clear public statements saying they see the end of smoking as the goal. They seem to be steadily making progress towards doing it. But other companies are still, as I say, ambivalent, and many of them have very strong Japanese roots.
Yes, because in New Zealand, I believe the tax rate is 80% less for vaping. And we know the tax rate is significantly less in Sweden between snus and cigarettes. So it is a real shame that Japan have almost taken a step back in this harm reduction approach. And speaking to Dr. Kumamaru from Japan, who's a heart specialist and a surgeon, you know him well.
Yes.
He was saying that it's a real credit to the consumers for how heated tobacco products have taken off, considering that there's no real Japanese medical society that are pro these products, and even the government are quite anti these products, and they insist on smoking cessation only as the only approach. So it's a real credit to the consumers. Do you want to maybe talk a bit about the power of the consumers in Japan and perhaps why the consumers have really taken to HTPs?
You know, most countries in public policy, the two leaders you expect to push public policy are the government, the scientists, the academics, and the physicians. Well, I think in Japan, we've actually got it about a different way.
Mm.
It's actually the consumers and the industry who are the industry supplying a product that has been deemed by the FDA and many others as being appropriate for the protection of public health. Consumers, particularly the smokers and their families, who are demanding access to safer products that will both improve their health outcomes, but they're also driven by other factors, which are cleanliness at home, the removal of smell and odor, respect for other people and not wanting to contaminate other people. That whole combination of consumer demand and consumer expressed wishes translates into, I think, why we're seeing this extraordinary success in Japan.
And we know that Japanese consumers, as you've said, are very health conscious. They have annual health checkups. They do a full blood screening. Dr. Kumamaru was telling me that earlier. And actually, producers in Japan are allowed to market their products as reduced harm, which some countries are not allowed. So we know that really resonates with the consumers in Japan being so health conscious. So it's really interesting. It's quite a unique model, I think.
Yeah, I think the other thing which makes Japan so interesting is that it is one of the world leaders in longevity and healthy aging. When I worked on projects with the World Economic Forum, we had a number of our meetings in Japan and met with the people in a center for super centenarians. These are people over the age of 110. Nowhere in the world do you have such a large group. And about a third of the people over 110 live full and productive, independent lives. A third need a bit of support, and a third of other issues. But when you try and look at what's driving this, it is this innate, strong desire to have long-term health benefits, to link reducing their risks from tobacco to healthy eating, to a lot of physical activity, to a strong focus on spirituality. So it's actually a deep, wide set, a country approach to valuing health and doing everything you can to remove the risks that should be removed. That's why, again, it goes back to the central importance of the government recognizing that a price differential, a warning differential that makes it easier for the remaining smokers to actually move to reduced risk products is coherent with their long-term goals of promoting longevity and healthy aging.
So that leads me nicely on to my last question, which is in terms of the lessons that other countries can learn and adopt from these Japanese consumers and their adoption of these products and what goes along with that as their values. What lessons can these countries learn then? What, advice do you have?
Well, I think besides the obvious issue of the fact that these products have been designed and do well to displace cigarettes, I think the deeper issue of the societal tolerance and support of health and well-being across the board. I think too often we talk about tobacco control separate from broader aspects of healthy aging. Reducing the risks of tobacco goes along with eating more healthily, being more active, leading a more spiritual life, taking part in diagnostics and treatment for conditions. And that is built into the Japanese culture. It's made easier by a government that has put in place since the Second World War primary healthcare facilities and access for all across the country, and is supported by some of the deeper, longer term cultural values of the Japanese people. Those are not easily translated into the rest of the world, but I do think that um, Japanese experts in this field could do well to talk about the broader experience in engaging with other countries who would see that it would have spin-offs across all aspects of non-communicable disease prevention and healthy aging.
A big thanks to Derek, especially for highlighting the importance of Japan offering a fuller range of smoke-free products, better cessation services, and the importance of the role of physicians in driving all aspects of health policy in Japan, in which they have a real opportunity to drive change even further, especially in the primary care clinics, where physicians can play a stronger role in the secondary care prevention related to smoking-related diseases. The annual screenings that many Japanese consumers use offers the opportunity for a close relationship between them and their physicians to combat the effects of smoking. Now we move on to Dr. Hiroya Kumamaru, our Japanese heart surgeon and a key author of this report. Hello, Dr. Kumamaru. It's a pleasure to have you with us today to discuss the latest report regarding lives saved by tobacco harm reduction in Japan, of which you are a key author. And congratulations on the release and launch of this report today.
Really honored to have a chance to talk about this theme, tobacco harm reduction in Japan. Like many other countries in the world, in Japan, smoking is the highest cause of death in each year, and it is followed by the hypertension or diabetes or kidney disease. As a new trend, hypertension is catching up the smoking, and it's almost overriding the position, but still, smoking is a big problem anyway. If you try to see the economical aspects influenced by smoking, we do have some income because of the tax. It's about 2.2 trillion yen a year. However, the expense we have to spend is much higher than this, which is 6.36 trillion, almost 3 times more. So it's a big issue anyway. And in Japan, a very interesting phenomenon happened since the heated tobacco product has launched. It started out the year 2014 to test or sailing, but it's started by the Philip Morris IQOS and Glow BAT and Plume Tech by JT, and it started actually the real sale has been started to year 2016. And it's quite amazing. Ever since this heated tobacco product has launched, the sales of cigarette has reduced so much, as you can see in this graph in red line. The black line is the total sales of any kind of tobacco. It was first 5-year trend, but if you see the smoking rate reduction, heated tobacco accelerated it as well. And if you compare to the smoking rate compared around the year 2010, it's almost half. So it's heated tobacco reduced smoking so much. So if we have seen this big interesting trend, and our group has estimated the possibility or potency of harm reduction as how many lives will be saved until year 2060. And we calculated that it's more than 2 million lives can be saved, not only from the reducing the disease itself or preventing the lung cancer as well. It's a big number. Of course, to achieve this, estimation, we have to try so hard in these key actions. The first one is activating health professionals, especially physicians and well as bureaucrats who are taking care of healthcare in the government to communicate the benefit of THR or to counter this information about nicotine or value of THR and so on. Secondly, encouraging risk proportionate regulation, like taxation should be reduced for the more healthier product of tobacco. That's very important. Thirdly, strengthening the consumer representation, because in Japan this new trend has not been promoted by the government or medical association. This consumer has a new trend of switching from the cigarettes to heated tobacco product. They maybe are thinking about their health and families' health as well. The Japanese people are quite health conscious, as you may know, because we're getting a health checkup each year, almost everybody. Fourthly, supporting clinical research, because we do need a clinical evidence that this tobacco harm reduction maneuver could cause lots of decrease of sickness or death in the long-term result. So these are the important points we should follow. And I do expect this would happen in several years in the future. Thank you for your attention.
So just to summarize, How have harm reduction methods contributed to what is now more than a 50% decline as of 2022 in cigarette sales in Japan?
Well, as I said, it hasn't been really promoted or advised by the medical society or the government because physicians in Japan, I would say, doesn't understand well about the tobacco harm reduction concept. I'll be very few physicians, maybe I would say 10 physicians are talking about it. Others avoid talking about it because the mainly in Japan the trend is basically the smoking cessation, not the harm reduction. So they ask smokers to stop smoking, not the reducing the number of tobacco or something. Use the better device or something like that. So this new trend would be caused by, I would say, that trend of probably younger age smokers who wants to have a healthier life or a new device. And they are thinking about the families for the passive smokers as well.
Thank you very much. Is there any final words you would like to say about the report or about Japan and smoke-free products?
This report is very intriguing and helpful for us. So I hope this kind of report will change the idea of Japanese physicians as government officers as well.
A big thank you to Dr. Kumamaru, who highlighted the fact that smoking is still the biggest cause of death in Japan, and he also showed a graph that showed a nearly 50% decline in cigarette sales since the introduction of heated tobacco products between 2011 and 2019. So now I will talk to you about the role and importance of science advocacy in tobacco harm reduction in Japan. So it's a privilege for me to address you today on the critical role of science advocacy in shaping public health strategies and saving lives, using the findings of this report as a guiding example. Firstly, let's talk about bridging knowledge and action with science advocacy. At its core, science advocacy is about turning data into action and bridging the gap between research and real-world impact. It ensures that complex evidence doesn't remain confined to academic circles, but influences policy, public awareness, and societal transformation. In the case of tobacco harm reduction, this advocacy is vital. Misinformation about nicotine does persist, and innovative products are often misunderstood or misrepresented. Science advocacy works to replace these barriers with informed understanding and practical solutions. The findings of this report reveal a stark truth. Conventional tobacco control strategies alone will not suffice. While WHO projects a decline in smoking prevalence, Japan still faces an annual toll of over 157,000 tobacco-related deaths. Advocacy is essential to catalyse the necessary changes and implement the report's recommendations. So now I'll talk to you about the power of science advocacy in Japan's tobacco landscape. So Japan is uniquely positioned to lead a global shift in tobacco harm reduction. The report highlights that heated tobacco products have already driven a 52% decline in cigarette sales over the last decade. Yet, the continued ban on other harm reduction products like e-cigarettes limits the full potential of tobacco harm reduction strategies. And science advocacy must rise to the challenge to unlock this potential. So key actions include activating health professionals. So advocacy must empower physicians and healthcare professionals to become champions of tobacco harm reduction. And the report stresses the importance of correcting widespread misconceptions among doctors, 89% of whom in Japan incorrectly associate nicotine with cancer. Engaging these trusted figures to communicate the benefits of tobacco harm reduction to patients will be pivotal. The second action is promoting risk proportionate regulation. Advocacy must push governments to embrace harm reduction as part of their tobacco control frameworks, and for Japan, this means regulating alternative nicotine products proportionate to their risk, making them accessible and affordable for adult smokers who cannot or will not quit otherwise. The third action, investing in research. National research on tobacco harm reduction is underdeveloped in Japan. Advocacy can drive investments in locally relevant studies, building expertise, and providing policymakers with the data needed to make informed decisions. This includes evaluating the impact of heated tobacco products and exploring the benefits of introducing other tobacco harm reduction products. And the fourth action, strengthening consumer representation. Science advocacy should amplify the voices of consumers and community groups advocating for tobacco harm reduction, and by empowering these groups with sound scientific evidence, they can become powerful agents of change. So finally, recommendations from the report, a call to action. The report's recommendations align seamlessly with the goals of science advocacy. To save 2.04 million lives by 2060, Japan must integrate THR into its tobacco control policies, leveraging the full spectrum of harm reduction products, improve access to cessation services and advanced lung cancer treatments, engage health professionals, consumers, and policymakers in a unified approach to combat tobacco-related harm. These actions are not just recommendations, they are a blueprint for transformative change, and by advocating for these measures, we can position Japan as a global leader in tobacco harm reduction, setting an example for other nations to follow. Of course, there are many examples of successful science advocacy in harm reduction from different countries, showcasing the transformative role of evidence-driven advocacy. For example, the Joint United Nations Programme on HIV/AIDS, or UNAIDS, has used evidence-based advocacy to drive global responses to the HIV/AIDS epidemic. For example, UNAIDS worked with researchers to model the impact of universal antiretroviral therapy, or ART, on reducing transmission. They advocated for the 90-90-90 targets. 90% of people living with HIV diagnosed, 90% of diagnosed individuals on ART, and 90% of those on ART achieving viral suppression by 2020. And the outcome of this was that the framework mobilised international funding and political commitment, accelerating global access to ART. So to conclude, science advocacy is not just an abstract ideal, it is the force that drives progress. And by championing the evidence and implementing the recommendations of this report, we can turn potential into reality, saving millions of lives in Japan and beyond. And together, let's ensure that the data we have today shapes the policies of tomorrow, creating a healthier, smoke-free future. So that brings me to the conclusions of this webinar. And as we conclude, it is clear that the findings of the LiveSave report present a powerful case for rethinking tobacco control strategies in Japan and beyond. And by integrating traditional measures with tobacco harm reduction and enhanced lung cancer treatments, Japan has the potential to save over 2.04 million lives by 2060. This isn't just a statistic, it's a vision of healthier futures for millions of individuals, families, and communities. So to realise this vision, the report offers several key recommendations covered by our speakers today. 1. Activate health professionals. Physicians and healthcare providers must be educated and empowered to communicate the science and benefits of tobacco harm reduction products. Correcting widespread misconceptions about nicotine is crucial to making tobacco harm reduction an effective tool in clinical settings. Action 2. Implement risk proportionate regulation. Policymakers should embrace THR as part of tobacco control, ensuring that less harmful alternatives like e-cigarettes and heated tobacco products are accessible, affordable, and acceptable for adult smokers who cannot or will not quit traditional methods. Recommendation 3, strengthen consumer representation. Advocacy from informed, independent consumer groups can amplify the demand for evidence-based harm reduction policies, ensuring that the voices of smokers seeking healthier options are heard. Number 4, invest in research and innovation. Japan's advanced healthcare and scientific expertise should be leveraged to generate local evidence on the impact of tobacco harm reduction. This will ensure that policies are guided by robust, context-specific data. Number 5, enhance cessation services and lung cancer treatment. Improved access to smoking cessation programs and early diagnosis of lung cancer, supported by innovative technologies like AI diagnostics or artificial intelligence diagnostics, will further reduce the burden of tobacco-related mortality. In embracing these strategies, Japan has an opportunity to lead the world in tobacco harm reduction, setting a global precedent for integrating innovation and compassion into public health policy. The path forward is clear, and by acting decisively today, we can transform public health outcomes for generations to come. Thank you for joining us, and I hope you leave inspired to champion these life-saving initiatives. That ends our webinar today. You can find our report on thr.net and on the Asia Harm Reduction Alliance website and on the X channels. So stay tuned. If you wish to contact Dr. Derek Yach about the report, you can email Derek at globalhealthconsults.net. Thank you.